Changes in heart.
Orthostatic hypotension with beta blockers. Know that there's certain kinds that affect asthma or exacerbate it.
Rebound hypertension. Changes in heart rate. Hold for under 60. Don't stop betas abruptly. Call doctor if heart rate's below 60. There is always going to be diabetic drugs on every single, there's going to be diabetes on every single thing you ever see. Obviously, it's going to be all over your NCLEX. So think about the different insulins. If they're taken with anything or before certain meals, how it's taken, short acting, long acting, cold, warm, how is it stored? Sliding scale, onset duration, those type of things. There's all, okay.
So it's stored in the fridge, right? But then when I was doing a practice question, it was saying like, if you're actively using it, it can be at room temperature. Is that right?
Right. Well, you would give it to them not cold.
Right. Okay. Got it. Okay. Thanks.
Do you shake it or do you roll it? Roll. Thank you. Don't shake the insulin. Okay. If you're giving short acting and long acting, which one comes first? Regular, then the NPH. Thank you. Risedronate. Risedronate. What's that given for? Osteoporosis. What are the things that you need to know about that? Maybe a select all that apply.
Sit up for 30 minutes after taking.
Yeah, take with a full glass of water. What do you teach your patient? Okay. Well, you know we love digoxin. So what's the normal digoxin level? You're all within the range here, right? 0.5 to 2, right? Depending on what cards and what we're looking at, correct? Range. If the patient is heart rate is low, what are we worried about? So we continue to don't give it under 60. Thank you. Signs and symptoms like of toxicity. Know the difference between early and late kind of thing. Okay, yeah, you guys are all over those kind of stuff. There's usually early is like, yeah. We kind of went through some questions like this earlier in classes. They'll hit on all your systems basically, right? And then as you go farther in, they get more pronounced. So just kind of look at that. There's one digoxin question that I believe I did not let through this time, actually. But if it did, I usually end up pulling it, but I did not see it. Not thinking about things. Nursing diagnoses and priority actions and things like that. So when you have a patient who is overdosed, say like on a barbiturate, what is our concern about like barbiturates? What is their vital sign we're concerned about? Respiratory depression. Thank you. So when we're looking at that, think about what our nursing action would be for those for our patients with that, okay? Because that's what we're concerned about. This one I really want to go over because I want you guys to think about this. I want you to critically think about this. Patient has an NPO order for surgery, but takes seizure medication. What should you do in the utopian hospital to make sure that they can get their medication? Because do we want to stop seizure medication? No. So I saw a couple different answers. So who would we get that order from, Stephanie? Please remember this. Okay. Do not just give it without getting permission. Make sure that you contact them and say, hey, did you see that they're on seizure meds and you told them to be absolutely NPO? Can I have an order, please? Okay. If you really trust the doctor in real life, you may be able to get away with a sip of water. If you and the doctor don't get along in the real life, don't do that because they will cancel that surgery on you and say that you messed up their whole schedule for the day because that patient's going to aspirate and they're not going to be responsible for it. And the nurse messed up their schedule. And you have to chart that you gave that. So it would be under you. So it all depends on your work situation, how it is. I would definitely, in the beginning of your career, make sure that you have an order for everything you give so that when I can review your chart, that if anything does go wrong during surgery, like a patient does aspirate after you gave a sip, that you actually had an order for that. Because everything goes downhill when things get looked at, and we are usually the downhill it goes on. So please go with the book answer for now. Okay. Anticonvulsant meds. So seizure meds. There's a black box warning. What are they at higher risk for? Yes. Correct. Good. What does narrow therapeutic index mean? The range between safe and toxic is small. Yes. Good. I already asked you about the things, so teaching with this. Side effects, adverse effects with anticonvulsants. Trying to think what I was thinking. I think that's the therapeutic index is kind of where I was going with that. We all know what gabapentin is normally used for, right? With this, what else do we use it for other than seizures? Nerve pain, anxiety, okay. Neurology, yep. Parkinson's, dyskinesia. Do you use insurance, right? What does Parkinson's look like in dyskinesia that's different? Their dyskinesia looks like. Unsteady gait, the pill rolling, the shuffling gait, like card movements, right? Those kind of thing. Okay. All right. Aminoglycosides. What are the first effects of this medication to monitor for? Mental health. Different than mental health. Good. All right, there's many different forms of the cyclovir that can be given. All for the same reason, but different types of, all right? So if you're teaching a patient about this medication and say they're, yeah, ointment, that kind of thing, hey, may burn or tingle, depending on how they put it. They need to know that. Use gloves. Right? Okay. Where are we on? 8. Oh, okay. What are the patient remedies for different overdoses? A patient come in, Narcan for, yep, benzo, okay. Yes. Hypovolemia IVK, yes. Okay, you guys are doing great. So those are the things you kind of want to look at, okay? We already talked about seizure medications. Yeah. Kind of thinking, what do you do when you do assessments, kind of things? What would you guys know this because it's kind of was on your med surg stuff, right? But good. Thank you. With how you would protect your seizure medication patients, and the things you would assess and stuff as you're taking care of your patient. Right. Anxiolytic administration, when you're also protecting your patient that's admitted during that time, what would you consider doing for them? Epinephrine. What are some uses of epinephrine? I know you guys know what the normal use is, or at least you should. Yes, that too. Cardiac arrest, and the other one is anaphylaxis. Thank you. I'm trying to think, I don't recall. I don't recall there being a question on there, but.
Sorry, did we talk about the administration considerations for anxiolytic? I just heard you say it, but then I didn't see any conversation.
No one mentioned anything, so I want you guys to think about it.
Okay.
I can't make people talk about it. Yeah, I don't think I saw much on that. So the dobutamine side effects, interactions.
Increased heart rate.
So you guys are on the same thing there. What does it interact with? Oh, okay. Like beta blockers? There we are. Okay, so beta blockers, side effects. Can they be stopped abruptly? No. Why are they used? History of MI, anti-hypertension. Heart rate. Considerations. Good, you guys are on the right track with those.
Rebound hypertension. Hypotension.
Take it the same time every day. Check the beep, yep. Orthostat, yep. All right. I take this and I'm still, this morning I can't say it, scopolamine. There we are. Over diabetes, yes, okay. Oh, I skipped the Flomax, but it's come up twice now. So you guys, I want you to think about side effects and considerations. But motion sickness, where do you put it? Nausea, yep. Ear, behind ear, yes. Okay. There are going to be a ton of cardiac drug adverse interaction side effects that might come up. I'm going to show you the next page because you can see this. They like that in Pharm and they like that in MedSurg too. So just think about teaching about this, right? So the differences between classes, right? Differences between types, side effects, considerations, possible nursing diagnosis, that kind of stuff on there.
Aren't both the atenolol and metoprolol the two asthma ones? Aren't they both? Ah, okay.
So you see all the C drugs are there too for heart. Because you know I love saying them all. And so that's how they have them on there. So think about, and prevention of MI, yes. So near amiodarone and Addison and adenosine. I don't know why I called it Addison. Adenosine. All the lovely ones. Think about nursing considerations, your side effects, your nursing diagnosis. That's what I'm saying on all of them. And then your, that kind of stuff. What big thing to think about is what's expected and what's not expected on these drugs. Because sometimes there'll be an expected answer in there. That's not what they're looking for. They want you guys to give the, like, what do you see? I'm trying to think of how to put it. With all right, where's my ER folks? When you give adenosine, what do you expect to happen? Dead for a second. Yes, so you expect and then start. Do not pick that as what is a adverse effect, because that's not an adverse effect. That is a side effect of the medicine that we expect. Does that make sense? Yes. So they are looking for something else there. Okay? Because all of us are waiting for that. That's the coolest thing about the medication. It's like, and then, okay, you're cool. It worked. Yay. Right? As long as it all goes in the way it's supposed to go. So that kind of thing. All right. I think that's so pick the not expected, not the expected. Yeah, that's where I'm going to go with that. Okay. So yes, cardiac drug teaching, just like cardiac stuff on the exams. They like that. Graves' disease. Patient has Graves' disease. I'm just basically going to give you the question. And they also have diabetes too. But they happen to also be on anti-aginal therapy. This patient is a mess. I don't know who wrote this question. Oh, darn it. That's not good, Stephanie. What do you have to warn this patient about when they go home? It is cool.
Sorry, can you say it one more time? I was reading through the chat answers.
Okay. We're down at Graves' disease. Patient has Graves' disease. Diabetes 2 medications on also. But they're also taking anti-anginal therapies, medications. This patient's a total mess. So, what do we need to teach this patient? Monitor their blood sugar for what? Hypo and hyperglycemia. That patient isn't going to have a lot of fun at home. But remember, that is what you're looking for. One will spike it and one will drop it. Yeah. Their doctors are not nice. But that's what's happening because they're a mess. Don't overthink that question. Okay? How do we know heparin is therapeutic? We have to know the labs. Some of you guys jumped ahead of the labs on the other test. Do not do things until you know if your patient's dying, please. Go to the labs first. Do not scare patients by pulling up a code cart, and we do not know if they need a code cart yet because we don't have the labs back. All right. What is with heparin? PTT. Thank you. That's why we have more than one of you here. This works well. Lovenox. Low-grade heparin, right? This question I feel is really... There's a monitor for bleeding. Don't aspirate. There is a nursing consideration that is... I don't even know who gave me this question. Those are all good nursing considerations. What is the, adverse, when you can't give it? Kayla. How do you know that? Who told you that?
I watched a simple nursing video last night. And it said something about like a hematoma can form or something.
Kaylee said it too. That is the adverse. You cannot give it if they have an epidural catheter. One of your teachers think they taught it to you because they gave it to me. Carly, you learned that on Mom Baby. I watched the same video. I don't know which one of your teachers gave that to me either. So that's funny. That is so funny. All right, so that is it. Tell your friends. Tell your classmates. So that's hilarious because one of your teachers gave it to me. If you get that question. Yes. I can't guarantee which question you're going to get, Jessie. Cholesterol, good, bad, and all that stuff. No, that's things on there. So what would you teach your patient about what they should know? Yes. What kind of patient are you looking for that would be on cholesterol medications?
OB.
Anybody gonna answer, Jesse? All right. Just look up those cholesterol things. Think about like what type of patient would be put on and when. All right. Serious inhibitors, we kind of already, that was on your, I just want you to realize that your nursing considerations, your interaction side effects. When I have it on there more than once, there's a reason. Thyroid medications. No one's really good at this because you guys are not old enough to have thyroid issues yet. But hyper and hypo, you've seen them on all your tests. Serious inhibitors. Thank you. Nursing considerations. When taking them, your interactions, your side effects, your adverse effects with thyroid medications, your thyroid storm. Levo is definitely in the morning before things, right? No missed doses. Good. You guys are doing good. So we had consistent timing, yes. We had a little bit on the last test, but same reactions to medications, blood transfusions, IVs, PO meds. Kind of went through a little bit of this earlier, but still the same kind of thing. What would we want to do? What's for the safety? What would we assess? What positioning? Those type of things. Stop the med before you contact the doctor. Stop the med before you contact the doctor. Put them in a position before you contact the doctor. Then contact the doctor. If a patient told you that they understood their diabetes, they would say what? Those teaching questions.
Check blood glucose before eating.
You guys are good. You guys are picking the right things. Okay. Can't get away from metformin. So think about adverse effects, nursing considerations with it. What about the kidneys? watch the kidneys. Okay. We've already mentioned some vitamins and stuff. There are some of those vitamin mineral things on here because that's part of your Pharm, right? Treatments and also what they're on. So also, as I'm going to get to the next page, I think it's on, same thing with, we live in an area where a lot of people like to do natural remedies and stuff. So vitamins and minerals come up a lot, also herbals, things like that. So think about recommendations and side effects and stuff like that and what they might interact with. So St. John's, what? We never use St. John's. I always love it when a patient's like, is that bad that I'm on this and I'm taking this bipolar med for like 4 years? Yes, no. What? Oral contraceptive teaching. If they're on other medications, yes. 2 forms, good. Side effects, interactions, smoking, yes. Blood clots, yes. You guys, yep. Antibiotics. Gotta be careful. Diuretics. Diuretic meds. Okay, teaching, side effects, nursing considerations, IV versus PO. Are labs important with diuretics? What labs are important? Never heard a patient be really happy about being on diuretics unless they're so full of fluid. They have no, they know they have to be on it, but you can't get away from medicines yet. You guys are still doing more on that. Okay. The potassium is such, I know. Well, you can't help it when you're peeing out everything, right? I think I ate like 100 bananas from HCTZ. Did not like that drug. You guys, someone did your diuretics really well. Addison's, we're not out of the woods with that yet. Yes. Will, good. Steroids. Immune suppression. Increased drug therapy when sick. There's a lot of things like that, right? Diabetes as well, those kind of stuff. If you have wounds, what do you have to do with those wounds or infection care? Oops, what are we looking for? Culture. She screamed it at us. Culture. We already talked about what about antibiotics. I may have that for a reason. Banco. Oh, I want to talk about this too. Yes. Red bands is a possibility. Why are people on Banco? Give slowly. MRSA, C. diff can happen, yes. Broad spectrum, don't know what it is, but why are they usually on something so rough, so high? Life-threatening infection, right? And something that is nothing else works, right? They've been on all the other antibiotics, sepsis, correct, those type of things. So they are drug resistant, they are at the end. If they start showing some of these lovely side effects while they start, like red mans, what are we doing as we see this? We're giving it too fast. So we slow it down, we decrease the rate. We give fluids to the... Do we stop it? I saw someone say stop it. Can we stop it? No, they need it. So as long as they don't continue, we just slow it down. I know that sounds crazy, but we don't have anything else. I mean, these are people who will end up getting fecal transfusions and things if we can't, right? You saw this in pre-op. Yeah, you just slow it the way down and hope that they don't continue to get worse. If they do, then of course we have to, but we do every intervention we can do to help the patient get through these things that are happening. So if you get a question like this, they are on this because they need it. So we are giving them this drug. So, it was a teenager that was already in that state. That is not a good sign. Don't stop giving Vancouvers. Don't stop giving Banco. Yeah. Oh, burst appy. Yeah. So you just have to slow it down and you have to keep giving them other interventions, but do not. Okay, that's what we have to do. So I want you guys to understand that. Because that's why it's different. A lot of times this is because people aren't finishing their antibiotics all the way through and their body gets really resistant. But a lot of our bugs are just becoming super bugs on their own also now. So, yeah, it's not a good situation. So there's a black box warning on a certain antibiotic. Which antibiotic is it? Tendon rupture. Yes. Owie. So, know that. Antivirals, adverse reactions that can happen with an antiviral. Megan was on it. She was looking ahead. Kills everything. So, it is. Yep, those are correct. Not just, but yes. But the big thing is really that, yes. Adverse reactions is all that kind of stuff. Because unfortunately, it doesn't know what it's attacking. So antivirals are good at doing everything. What do you give your patient that's allergic to penicillin? That's okay. Just realize that they give you couple antibiotics that you should know the antibiotic that's allowed. So these last two kind of go together, right? So certain time of day, patient takes their diabetes meds. We kind of talked about that. Their blood pressure meds, their diuretics, their thyroid meds, they all have certain time of day. Potassium supplements. Are there contraindications? Wow, I have to slow it down. To these medications? Those might be important to think about as you're teaching your patients. Okay. You guys already talked about like when to give the thyroid and stuff like that, but just think about thyroids. Okay. So much. Okay. What? These fit nowhere else. So I just kind of threw them on here. Decongestants. I gave you the nasal ones, but they're oral ones too, right? So the different forms, when would be a benefit of having a different form? Your warnings, considerations with that, side effects. MDI, I think I already kind of went over that too, the considerations, interactions. TB, thinking about why they would get more than one drug. What would be the purpose of that? Gout. Lab, so yep, that's apparent, yes. Side effects, right? Think about what you want them to know. What can they have on this? What can't they have when they're on this? It's a lot of the big ones. Even like your barbiturates and things like that with your overdose, what can they have? What can't they have in their, that kind of stuff in their day-to-day life. Antacids, there's different types. What would be the side effects depending on the type? Anyone going to answer Leah? Nothing fun with gout. Yeah, what does that fall under? You guys remember what that's called? Thank you, Kaylee. So one type of antacid like gives you constipation, one gives you diarrhea, when you're allowed to have certain foods on, the other one you're not. Yes. Aluminum, yes. So think about those type of things. Aspirin. Taken a lot, especially lately, I guess. What are our concerns? Not with anti-coaguls, bleed risk, not kids, not kids. You shouldn't take it with your ibuprofen, correct? So those kind of things, long-term being on them, what are we worried about? Those type of things. Didn't we already do antihistamines on the other page? Right now, is that what you're trying? Warfarin interactions. Like Reynolds better. Warfarin has a lot of lovely little things. Pretty much everything. That's why I said warfarin has a lot of lovely little things. It's one of those meds they like to give out, but then I don't know if they do enough teaching with it, but so many things. So this is where I was talking about over-the-counters, patients' mental health. What could interact with their medications? Can they take herbals? Should they take herbals? What can you teach them about them, right? Are there concerns that you should consider if your patient's on an SSRI with other medications like herbals? What are the side effects? Those type of things. So I'll talk about like ginkgo, valerian, ginger, soy, saw palmetto, St. John's wort, ginseng, garlic. I don't think you can take anything with St. John's wort. So, serotonin syndrome. God, gotta be so careful. So these are all your mental health kind of things, right? So think about all the drugs. Phenobarbital, clozapine. Why don't we have a lot of people on tricyclics anymore? Why do we have them on SSRIs instead? SSRIs deal with herbals. There is a lot of side effects. What age group has a black box warning? Adolescents, correct. Increased suicidal ideation, correct. These are ones I had no idea where to put them. So, I just gave you what they had. So, Zantac kind of could have gone with the other stuff, so I guess, but they had it listed, so I want you to have it. Lidocaine, xylocaine injection. Oh, we already talked about Humulin and that stuff, but I want to make sure you guys think about the onset duration. Morphine. I don't think I talked about that. I think that was on your other test too. Sunscreens. There's a couple sunscreen questions that can come up. What teaching? It's supposed to be reapply. I don't know why I put reply. I think it's because I did this at 10 o'clock at night. So let's reapply. So, like what's important, what kind of teaching, that kind of stuff. Hydroxychloroquine. Other uses other than what people use for COVID-19. Of course, we're not on hydroxychloroquine anymore. We've moved on. But yes, both those answers are correct. Thank you. So, yep. So those are your, it's there. I need you guys to remember, these are questions that are aimed towards your NCLEX review kind of stuff. So they have given me mostly teaching questions and stuff like that. So it's teaching at the bedside, side effects, adverse effects, expected versus unexpected, like we do in class, that we've talked about, nursing considerations, don't delay care with your priority questions. Think about with the patient, if you're reading it, everything's good, that's good, then go that way if that's what the question is asking. But if everything's going wrong, what is the most important thing to do? Do that. That's what we're looking for. Labs. Certain medications have lots of labs. Certain medications have no labs that are important. So that's kind of something that I'm trying to get you guys to look at a little bit. That's a nursing consideration. So that's what you'll see if you go back to your Pharm notes. The ones that have labs that are important, they're in there with the nursing consideration. There's not as much as this on there, but there are a few drugs that it matters with and looking at. So not even as much as the last time. So, but really think about what the question's asking. I think I said this to you guys several times during the last test. If it says an intervention, do an intervention. If it says assess, please assess with it. A lot of them are teaching questions and administering questions. I still like books like, let me get out of this. I'll get this in a second. Let me show you the last slide real quick. This is kind of, I like this cheat geography thing that I found online, but like the nurse taking the drug interaction, the pharmacodynamics, kinetics, absorption, distribution, those type of things. Grapefruit juice, I love that's on here because you can't hardly have grapefruit juice with anything, right? So that kind of thing, and nutrients, type of stuff. So I thought this was a cute little thing that someone had. But
is this on Canvas?
It's on Canvas again. Yep.
Okay, cool.
Let me see here. Let me stop sharing. So this little books that I've told you guys all quarter that I like, these type of things that has just the drug and then the nursing consideration and the side effects that some of you guys have. I love these type of books but your notes are the same way. They're a little bit more involved on your PowerPoints from your classes, but you have the same thing. So that is what you need to know, the side effects, your adverse effects, your nursing considerations, when the onset is, when's the peak, when's the duration, those type of things. That's how these are. That's how your NCLEX is when they ask you questions. So those things work very well. Otherwise, you have those in your notes from Pharm. You have those last quarter from from transitions when they went over Pharm stuff. You have the brunch on the Pharm from Will that's under my course resources that you can look back at. You have boot camps on Pharm that are in the course. You have hopefully your Pharm workbook still. You have Pharm end of chapter stuff, but look for teaching questions. This is what we're looking at. Seth, we'll have 5 dosage calc questions and 65 questions on this, as long as it gets put on correctly today. So we will see. 70 total. I threw out 5 of your other questions from your med-surg. There will not be 5 questions thrown out on this exam. So, as I went through that.
Are the grades already changed for the med-surg one that you did? That you
Nope.
threw out the 5 questions? Okay.
Nope. Like I said, I started with, there are some people whose are, but not everybody's, because I started this morning at 8 putting in the new ones. But there is, like I said, 8 of your split cohorts. And so that was, yes, that's one of the ones I got. If you got it wrong, I gave back. So there's 6 total because that one's separate from the 5. Although the traction question really only had one answer. The other ones were really, really wrong. But I did give it back if you didn't get it. Also, there is a question I gave back that I need you guys to remember when you're on NCLEX. Please do not do. It was an urgent care question. About a patient coming in, and you know nothing about this patient. You don't know their age. You don't know anything. They just have a cough, and their SAT is like 88. You know nothing else about them. You've never seen this patient before. You guys remember that one? The people who had it? Yes. Okay. Jesse, you guys are in panic mode. We don't know how old they are. So we don't know that. But, and this is why I'm giving it back, but I need you guys to think about this. You said you would assess for, not everyone said this, but some people, a lot of people said assessing for COPD or asthma. I want to know if that is within the nursing scope to do that, to assess for a disease. Who would do that? And one of the questions was to contact the HCP. So remember when you're on, I gave it back to anyone who had it. You can assess for dyspnea, you can assess lung sounds, you can assess a whole bunch of other things, but you cannot assess for a disease. So on your NCLEX, when you get to a question like that, do not get tricked, because you can assess for all those type of things that you can listen for, but you cannot assess for a disease. Does that make sense? Okay. So I just wanted to take this learning moment before you guys get to an NCLEX question that does that. So you will see the grade change. They're going to be in hopefully by 8 after I have all my meetings with students today. I'm trying to get them all in. I'm trying. It's really, you guys, there's 120 of you. It takes a while to go through every single exam. I have to go through it manually. The Canvas does not put it in for me. I have to go through every single test and put it in manually. So, oh, in my next life. So that's why I like Blackboard better, because when we had Blackboard, it did it. If I found a question and changed it, it automatically did all your guys. Canvas does not automatically change it. Canvas makes you go through every single person's tests manually. So it takes a little bit of time. So I will be as close to 8 as I can after I meet with all y'all. Bring back Blackboard. Oh my gosh. I wish. All right, questions. You guys did great today. I hope this was helpful. I will see you either Monday or Tuesday, depending on who you are. How many questions did I say I was giving back? 5. 6 if you missed the traction question. 15. You wish. You wish that. 100%. If I could only. Hi, what? Stay on, like I said before.